Okay, for the sake of time, I'm going to go ahead and get started. Did everyone have a nice lunch? Who went across the street? How's the weather? Yeah, yeah. I'm looking for people with frizzy hair right now with the humidity. Yes, it's very hot. Well, welcome back. For the next 2 hours, we're going to be reviewing the Laboratory Identified Event Module within the long-term care facility component. So here's the instructions for joining Poll Everywhere. I think you guys have this by now. Does anyone need me to keep this slide up for a minute? Are you good? Just raise your hand if I need to keep it up. Okay. And here are the instructions if you're joining via web. Okay, for this session, we have several learning objectives. We're going to demonstrate an understanding of LabID event surveillance and reporting for NHSN. We're going to explain Clostridioides difficile infection and multi-drug resistant organism LabID event definitions and protocols, describe how to enter LabID event data into the NHSN application, define required monthly summary data for CDI and MDRO LabID event reporting, and explain the importance of and the steps for resolving data quality alerts. I would imagine that many of you already report into the LabID event module. Is there anyone in here that is brand new to LabID event reporting? Here? Okay. Are you planning on potentially reporting in the LabID event module? Okay. So as we go through this, the LabID event module is different from HAI reporting. So let me know if you get stuck on anything. Write down your questions. I'll kind of pause because I want to make sure that you understand this before you leave today, okay? Because I do understand that this can get confusing. Okay, so you've seen this slide here. So for today, we're focusing on this LabID event. So you'll hear it called Laboratory Identified Event or LabID Event. And within that module, there are options to report C. difficile infections so you can do C. difficile and multi-drug resistant organisms, or you can do or. You don't have to do both. So you have options there. This module is available to certified skilled nursing facilities as well as intermediate chronic care facilities for the developmentally disabled as well as nursing homes. So assisted living facilities, residential care facilities are not eligible to report into this module. So what is laboratory identified event reporting? So as I said, this type of reporting is type of surveillance is a little bit different than what many are used to when you think of just HAI surveillance. So with LabID event surveillance, you're using standardized case definitions that incorporate both laboratory-based metrics and limited data from admission. And you're using that data together to look at a proxy, which is a guess, an estimate for certain infection events in your facility. With LabID event reporting, clinical evaluation of the resident is not required, and that makes this type of surveillance really ideal if you're looking for something that is less labor intensive, because you're not spending a lot of time in the charts looking for individual resident information. Really, you're just looking at the lab report and admission information. And the application does a lot of the thinking for you. So you have minimal chart review with LabID event surveillance. And it allows you to get an objective understanding of what is going on in your facility in terms of C. difficile or specific MDROs. So you're able to estimate infection burden in your facility of a particular MDRO or C. diff. You're able to estimate exposure burden. You're able to assess the need for and effectiveness of your prevention strategies that you have in place. And because the surveillance definitions are so objective, it really does allow you to compare your data year after year. If you are performing LabID event surveillance year after year, then you are going to notice trends in your data, and you'll be able to recognize if the trends are going up or going down. Another important thing to mention is that you'll be able to really compare your data against other long-term care facilities' data, because you're both using the same metrics to collect the data. So there are some rules when you're using LabID event reporting, so I'm going to discuss those first. Surveillance must occur for all resident care locations in the facility. We refer to this as facility-wide inpatient or FAC-wide in. So when you set up your monthly reporting plan and you select LabID, so if you select C. difficile LabID event reporting, the location option is automatically FAC-wide in. And what that means is that you must perform surveillance for all resident care locations in the facility. You can't just say, I just want to look at my skilled nursing unit. You can't do that. So when you choose to participate in the module, you have to do the surveillance facility-wide. Not to say that you can't get data on these individual units, because when you report an event, you are listing the location of that resident. So you are able to analyze data based on location, but you have to report facility-wide. Facilities must report non-duplicate test results for specimens collected from a resident in your facility, physically present in your facility. So that means that that specimen is collected while that resident is inside your home, okay? There is one exception to that, and that is for residents who go out temporarily for an outpatient visit. So let's say Mr. Smith goes to see his family doctor, does a stool test, and it comes back positive. That does get reported by your facility because it's just an in and out outpatient visit. It is not a transfer or a readmission. Same thing if your resident goes to the emergency department and the emergency department does a stool sample. If that's positive, then you will need to report that. If the resident returns back to your facility either the day he or she leaves for that outpatient visit or the next day. So what that means is that current admission date does not change. So that's the only instance where you would report a specimen not collected in your facility. Do not report LabID events for positive tests that were collected while the resident was receiving inpatient care in another healthcare facility at the time of specimen collection. So Mr. Smith has diarrhea in your facility. You send him to the ER. The ER decides to admit him. And during that admission, they do a stool test that's positive. You do not report that for your facility. The hospital will report that on their end because he did not have the specimen collected from your facility. And although he went to the emergency department, he was later admitted. So he didn't come back within those 2 calendar days. Okay, so that would not be reported. Do not report a LabID event for a specimen collected prior to a resident's admission. So Miss Smith is in the hospital and they decide she needs some skilled care and she has a history of C. difficile. And so they transfer her to your facility. You see on the admission record, history of C. difficile, okay? But you guys did not do a test on her, so you do not report that, okay? Unless your facility actually collects a specimen from her. Does that make sense? So remember we talked about the monthly participation requirements. Well, the first thing you have to do is that NHSN monthly reporting plan, right? That plan has to be in place for every calendar month that you would like to submit data to NHSN. The surveillance must occur for the entire calendar month as well, again, for the FAC-wide in. You're going to submit all non-duplicate positive specimens to NHSN. And then at the end of each month, you'll submit that summary data, which is your denominator data, and then you're going to resolve alerts. So these are the requirements to participate in this module, and I'm going to go over how to do each of these requirements for you. This is outlined in the protocol, but I did want to review when you participate in the LabID Event Module, you have, like I said, the Clostridioides difficile infection, or CDI, or C. diff, or C. difficile option. You also have the multi-drug resistant organism option. And the facility can choose to monitor one or more. You could monitor all of them if you wanted to. I'm not going to read this list to you because we're going to dive into a deeper dive, and then I'll go through the list, but it's here for you. Okay, so we're going to start by talking about the C. difficile infection module. What? You guys hungry? I hear they have a great ice cream shop in town. So if you're thinking about, do I need to implement C. difficile surveillance in my facility? Here are some things you can kind of think about, maybe talk to your committee members when you're trying to decide if this is worth your time in surveillance or not. How do we currently define CDI in our facility? Do we have a definition for which residents truly have CDI versus not? How do we track or measure CDI? Do we know who has it? Do we know which pods or units they're on, which beds they're in? Are your rates high? Do you even know what your rates are? What about the community? Do you know what the C. diff is coming into your facility in the local community? Are there other hospitals, nursing homes within your, I guess, admission transfer facility where these residents and patients could be coming in? Do you have a higher percentage of skilled nursing residents versus long stay residents? Because we know skilled nursing residents tend to be at higher risk, right? Do you know what percentage of your residents were recently hospitalized on antibiotics maybe? And does that impact the rates that you're seeing or not seeing in your facility? So these are just some questions that you can ponder on in your spare time today. Knowledge check 1. Describe how C. difficile LabID event surveillance is performed in a participating NHSN long-term care facility. So I'm going to go to okay. So A, the facility uses the CDC's NHSN metrics to identify and report residents with C. difficile in all resident care locations in the facility. B, the facility uses the CDC's NHSN HAI methods to identify and report residents with C. difficile in all resident care locations in the facility. Or C, the facility uses the CDC's NHSN laboratory identified metrics to identify and report residents with C. difficile in the skilled nursing locations in the facility. You guys are correct. So the correct answer is A. So remember, your surveillance will include all residents in your facility. Back wide in. Good job. So just as a reminder, keep in mind the following. Back wide in surveillance is required for all resident care locations. You want to make sure that you have policies in place so that only the laboratory is only testing unformed stools. You want a policy so that if the lab receives a formed stool specimen, like the picture I just showed you, they're not testing that. Because if they are testing that, it's possible they could be picking up colonization. If it's positive, do we really think that's an infection versus colonization? As an IP doing surveillance, you don't want to have to look for documentation. Was it loose stool? Was it formed stool? So the easiest way to prevent that is have a policy in place. The lab is going to reject formed stool specimens for C. difficile. And remember, any positive tests that occur before that resident's admission to your facility are excluded. And then you're only looking at specimens collected in your facility, or if collected in an outpatient setting, like the emergency department, physician's office, if that resident returns back on the day of the visit or the following. So let's talk about some common terms and definitions used in the LabID Event Module for C. difficile. So we have C. difficile positive laboratory assay, and this is defined as an unformed loose stool that tests positive for C. difficile toxin A and or B, and it does include molecular assays, so your PCR testing, which is really popular right now, or toxin assays. May also be a toxin producing C. difficile organism tested or detected by culture or other laboratory means. Then when you look at a duplicate C. difficile positive laboratory assay, that is any C. difficile positive toxin collected from the same resident, remember, while being cared for in your facility, following a positive in the previous 14 days. So Mr. Smith has a positive test on March 1st. You report that. He has a positive test on March 10th. Do you report that? No, that would be considered a duplicate. And then a CDI LabID event is a non-duplicate positive C. difficile positive laboratory assay. That's a mouthful. We have this algorithm in the protocol. I recommend that you print this, hang it somewhere so that it's easily accessible to you. It's just a great reminder of the how to identify which stool specimens are reportable versus non-reportable. Okay, knowledge check number 2. Mr. Bill transferred to your facility from the local hospital on May 1st. According to his admission record, he completed treatment for C. difficile prior to transfer. 2 days after being transferred to your facility, the new internist ordered a C. diff test just to be on the safe side. On May 4th, the stool specimen was positive for toxin A. Does this test result qualify as a CDI LabID event that must be reported to NHSN? Yes, because the specimen was collected while the resident was receiving care in your facility. B, no, because he had a documented history of CDI while in another facility. Or C, no, because the test was collected over the weekend. This was close. Okay. The correct answer is A. Yes, you would submit this because the specimen was collected while the resident was receiving care in your facility. So even if that resident comes in with a history of C. difficile, if that specimen is still collected while he's in your facility, it does get reported, okay, because it's considered a non-duplicate specimen. So just like you would not report specimens collected in another facility, those specimens also don't count toward that 14-day rule. The 14-day rule only applies to specimens collected in your facility. And as we get further along, you're going to learn about the categorizations that NHSN assigns to these LabID events, and I think it'll help you to understand why this is important. Okay, let's try another one. Mr. Lloyd, a resident in your long-term care facility, was readmitted to your facility after a brief inpatient stay at the local acute care hospital. You read in his chart that during his admission in the acute care facility, he tested positive for C. difficile. Should you report a CDI LabID event for the positive C. diff test result that was collected during his admission in the acute care facility? Yeah, this one was easy. Good job. So you would not report that because it was collected prior to his admission. So what you don't submit to NHSN, I'm going to save you some time. You don't submit negatives. So if the assay is negative, no need to submit that. And you don't submit results from specimens obtained in another healthcare facility unless it's an outpatient setting. And then you don't report duplicates. Okay, let's continue with Mr. Lloyd. What if Mr. Lloyd had another positive C. diff test result 2 days after returning to your facility? Should you report this specimen? Correct answer is yes. So specimen was collected while receiving care in your long-term care facility. Okay, let's go on to Miss Taylor. Miss Taylor, a resident in your long-term care facility, was transferred to an emergency department on June 1st for complaints of ongoing diarrhea and fever. A stool specimen collected in the ED tested positive for C. difficile. After receiving IV fluids, Miss Taylor was transferred back to your facility on June 2nd and was placed in contact isolation. Should you report the positive C. diff test result from the emergency department as a CDI LabID event for your facility? I think someone's just playing with us. Okay, 76% of you are correct. 82% of you are correct. So the specimen was collected while she was receiving care in that outpatient facility, right? And then she did return back to your facility within 2 calendar days. So the very next day she returned, so you would include that specimen. Now, if Miss Taylor had been admitted to that hospital, at that point, would you still report it? No, because she's not returning back to your facility. So we have it set up that way because the thought is if she returns back, she's going to come back with those test results, right? It'll be easy for you to see what's going on. But if she gets admitted, then it's possible that those test results get lost within the transfer paperwork. And so it's possible that you could miss seeing the result. And we're trying to make it easy for you all to identify and report. And we want to make sure that knowing that some facilities have more resources and are able to do more surveillance compared to resource deficient facilities. So we want to make sure that you're kind of capturing close to the same things. Some facilities will be able to get that information and some will not. So that's kind of the reasoning behind that rule that we have. I'm going to talk to you a little bit about the categorization. So NHSN will categorize all of your LabID events. You do not do this. You enter the events and then NHSN will look at the current admission date and the specimen collection date and will determine if that specimen is considered community onset, long-term care facility onset. If it's a long-term care facility onset, NHSN will look back to see if it's attributable to acute care transfer. And if so, it will be categorized as acute care transfer, long-term care facility onset, or ACT low. And then the application will also determine if the event is incident versus recurrent. So let's look at some of these definitions here. So community onset will be assigned if the specimen is collected in the first 3 calendar days of admission, with admission being day 1. So day 1, 2, or 3 of admission, those are considered community onset. Long-term care facility onset is assigned for any specimens collected on or after 4 days from the current admission date. Those long-term care facility onset events are then further categorized as ACT low, acute care transfer, right? If you indicated when you reported that event that the resident recently transferred from an acute care facility. If that resident recently transferred to your facility from acute care within the previous 4 weeks of that specimen collection date, NHSN will categorize that event as acute care transfer, long-term care facility onset. So here's the question here so that you know. So when you're entering these events, all of the questions are important, but this one determines, part of the categorization. So really important that if you know that resident has recently transferred, that you're able to get that date and put in the accurate date so the categorization will be correct for you. So here's just a visual of, March. So if your resident has a current admission date of March 1st, then any specimen collected on March 1st, 2nd, or 3rd will all be categorized as community onset. Anything beyond that is long-term care facility onset. It's very, very important to the rates and to risk adjustment that you're reporting both community onset as well as long-term care facility onset. Because remember, part of the benefit of the LabID event is you're able to look at burden of C. diff coming into your facility. Well, if you're not reporting the community onset, you're not going to have an idea of the burden coming in. So it's really important that you're reporting all those positive non-duplicate specimens so that you're able to capture that burden estimate coming in. In addition to community onset and long-term care facility onset, the application will also categorize the CDI as incident versus recurrent. An incident is assigned to any specimen that is either the first specimen entered for that resident, okay, so that's a new incident specimen, or if the specimen was collected more than 8 weeks after the most recent specimen, okay. So more than 8 weeks has gone by without a CDI LabID event. Anything that's entered after 8 weeks will be assigned an incident CDI LabID event. Recurrent is anything less. So Mr. Smith has a positive assay on March 1st. Then you enter another positive assay on March 25th. The first one will be what? Incident. The second one will be recurrent. Okay, and I just, this is just a screenshot of some of the data analysis options that are available to you, because I just wanted you to kind of get an idea. If you're going to any of the labs, one of the 2 labs today or tomorrow, you're going to see all of this and play in these data sets, but I just wanted to give you this so you can kind of put it in context of why these data are important and understanding the categorizations. Okay, so we're going to review. This is not poll everywhere. I could not figure out how to make this a poll everywhere slide, so we're just going to do this by show of hands, or if you want to just shout out, jump up and down, whatever you want to do. Okay, so our resident IDs are here. This is their current admission date, and this is specimen collection date. And this lets us know if they've had a previous positive, okay? So if previous positive is none, then that means they've had no previous positive in our facility. So let's look at resident 10. Resident 10 has a current admission date of 2/1, specimen collection date of 2/2, and no previous positive. Do we submit this as a LabID event? Very good. Resident 11, current admission 2/15, specimen collection 2/25, no previous positive. Do we submit this? Okay. Resident ID 12, admission 2/1, specimen collection 2/1, no previous positive. Would you submit this? Yes. Okay. Resident 10 again. Okay, so current admission is 2/1. The specimen is collected on 2/10, and he had a previous positive on 2/19. Or excuse me, 2/2. No, this is a duplicate. Okay, another new resident, 13. Admission 2/20, specimen collection 2/17, previous positive none. Tell me why you say no. What do you recognize about this? You guys are smart that you picked that up. So the admission is 2/20. Exactly. The specimen was collected too soon. So one of 2 things are going on. Either the specimen collection date is wrong, or somehow this resident ended up on your line list when the specimen was collected prior to admission. So in this case, you would not enter this as a LabID event. What I would recommend is just take a look at the specimen collection date just to make sure that it didn't get keyed in wrong, but otherwise this would not be reported for your facility. Good job. Okay, we have resident 11 again. New admission date of 3/1, specimen collection date of 3/7, and the previous positive of 2/25. So what do you think about the fact that the admission date changed? Do you think that plays any role in the duplicate versus non-duplicate? So even if your resident's current admission changes, you're still looking at that previous specimen collection date, right? So as long as the previous specimen collection was 2/25, so it's still considered a duplicate, even though the current admission changed, it's still a duplicate based on the most previous positive result. Does that make sense? Okay. So we're back at resident 10 again. Resident 10 is a troublemaker. Current admission 2/1, specimen collection 2/18, previous positive 2/10. What do you guys think? So this one is tricky because we entered, so if you go here, so we entered a LabID event here for 2/10, right? But we did not enter one here because it was a duplicate. So if you're looking at this one, this is an example of what can confuse. If you want to confuse the NHSN application, this is how you do it. Because the application only knows the last specimen you entered, right? So it will stop you if you enter 2 specimens within 14 days. But because this resident got tricky and had a specimen collection on 2/10 that wasn't entered, NHSN doesn't know about that. Only you know about that. So you have to base it off of your line list, because if you enter this into NHSN, it will take it because it doesn't know about that specimen collected on 2/10. Does that make sense? So that one's kind of tricky. You guys did very well on that. Okay, so let's talk a little bit about the monthly reporting plan. We've already talked about that it informs NHSN which modules and events you're going to be performing surveillance for, and we've talked about this, so I am not going to spend time on this slide other than to say, remember, before you get ready to report any events, make sure that you have a plan in place already, because if you don't, you're going to get this nice pop-up message that says no plan in place and you've wasted 3 minutes of your time. Okay. So go back to your home screen. Remember that left navigation here, and you're going to go to Reporting Plan, Add. Once you do that, you're just going to populate here for you, and you're going to select the month and year in which you plan to have this plan in place. So I've selected April 2019, and my facility is only interested in performing C. difficile surveillance for the month. So FAC-wide in is the default. You can't change that. Organism type from the drop-down, I would select C. difficile, and then the LabID will auto-check. So really easy, and then click Save, and that's my reporting plan for the month of April. Okay, knowledge check 6. Based on this reporting plan, what modules and events will this facility report for June 2018? So UTI only, all LabID events are C. difficile only. 100% of you are 100% correct. Good job. Okay, so next I want to talk about how to submit a CDI LabID event. Remember, we do have these optional forms that are available. Again, they are optional. Once you get the hang of doing this, honestly, I don't think you're going to need the forms for CDI because it's pretty easy. The lab date, result, admission date. But if you're new, these forms will be extremely helpful for you as you're learning the module and just learning what kind of data elements have to be collected and so forth. And so remember, you can customize the forms if you want to capture additional data elements. Another idea, if you're really tight on resources and you have CNAs in your facility that would maybe be interested in learning a little bit about surveillance, maybe you put some of these forms at the nurse's station and say, hey, if you get a positive C. diff test, would you mind just filling out a form and simply just give me the resident ID or name and checking C. difficile positive. You know, you can get creative, but use our forms if you'd like. They're on our website. We have instructions with the forms that give you details for every single question on the form. The instructions will tell you how to answer that question. Okay, to submit an event from your home page, you're going to go to Event and Add. And this is what's going to populate for you. Everything with a red asterisk is required. So for the resident information, you're going to want to enter your resident ID. Your facility ID will auto-populate for you. So you enter that resident ID, the gender, and date of birth. That is all you have to enter. If you want to enter more, by all means do. Some people like to enter the name because when they print a line list, they like to see the resident name. It makes it more personalized. You are free to do that. Once you enter the resident for the first time, any events that you enter after that, the resident information will auto-populate. So you only have to do this one time for each resident, okay? And then you come down to the event-specific information. So the resident type, you want to identify, was this resident a short-stay resident or a long-stay resident? And this is based on the NHSN definition. So short-stay would be on the date of specimen collection, so the event date. The resident had been in this facility for 100 days or less. So this is your from the first date of admission. Our long stay would be on the date of specimen collection. The resident had been in your facility for more than 100 days from the date of first admission. I'll give you a little secret. Beginning in 2020, this question will auto-populate. The answer is going to auto-populate for you because we're able to capture this information based on information that you enter in the application. So you'll have to answer this for the remainder of this year, but starting next year, we'll auto-populate this for you. You're going to enter the date of first admission to your facility and then the date of current admission to your facility. So first admission would be the same unless the resident leaves your facility for more than 30 consecutive days. The date of current admission does change if the resident leaves for more than 2 calendar days. Otherwise, if the resident comes in, does not leave, you'll see that your date of first and your date of current are the same. But if that resident leaves and has been out of your facility for more than 2 calendar days, you're going to want to update that date of current admission, okay? Because remember, the date of current admission is what is used to categorize your LabID event. So that's an important date. Then you're going to come down to this event information section, and you're going to select your event type. So it would be a LabID event. And enter your date of current admission and the date of specimen collection, which is also referred to as the event date or date of event. And you guys have already figured this out. The date of specimen collection must not occur before that date of current admission. Next, you're going to select the specific organism type. In this case, it would be C. difficile. Once you select C. difficile, this bottom part is going to auto-populate for you. So the organism type, body site, and specimen source are going to all auto-populate. So that'll save you some time. Next, you're going to select your resident care location. So that is the location of the resident at the time the specimen was collected. And remember those locations, this is why it's really important for you to set these locations up immediately after you enroll. Because what do you think happens when you get to this question? And maybe this has happened to some of you in the room. You get to this question and you click the down arrow and nothing is there. Has that happened to anyone? we get some questions about it. And if what that means, in case it happens to you, it just means your locations haven't been mapped. So you'll just need to go back in and map your locations. And once you map your locations, you do it one time, and then you don't have to do it again unless you get a new location or that unit closes down. Okay, so one-time thing. And then you select your primary resident service type, which kind of coordinates with the location. Okay, let's see if you're listening. I'm entering a CDI LabID event for a resident in my facility, but when I try to select her resident care location, the drop-down box is blank. What is wrong? A, the resident doesn't really have a CDI. B, the resident is not really a resident in your facility. Or C, the resident care locations have not been set up or mapped for your facility, and you must do this before submitting an event. You guys are 100% correct. Good job. See, you are listening. After lunch is hard. Okay. And then I know I've said this a lot. Really, this little guy should be blue because I feel like I've said this until I'm blue in the face. Okay, so then the next question is going to ask you, and this is another really important question, has the resident been transferred from an acute care facility in the previous 4 weeks? If yes, you're going to select yes, and then once you hit, if you select no, then that's it. But if you do select yes, it's going to ask for the date. And this is really important because remember, part of the categorization comes from the date you enter. So if the date you enter is within 4 weeks of that specimen collection date, this resident is going to get categorized as what? Act low, if it's a long-term care facility onset. Then you're going to get a question that says, if this resident has been transferred to your facility in the previous 4 weeks, was the resident on antibiotic therapy for this specific organism type at the time of your transfer? So what it's asking you is, at the time of transfer, was this resident being treated for C. difficile infection? And this is another important question because it informs the burden of C. diff coming into your facility, and you're able to run reports and get nice information about this. So you select yes, but only if the resident is coming in on treatment. Now, if you select yes to this, then you're also going to select yes in the denominator, the summary data for admission on treatment. So we'll talk more about that when we get to it. Here are 3 medications that you may notice in the chart or the pharmacy record if your resident did get admitted on treatment for C. difficile. So you may notice the metronidazole, the oral vancomycin, or the you guys know what I'm talking about. Fidaxomicin. My ID doctor told me how to pronounce this again. Fidaxomicin. That's it. Fidaxomicin. I got it? Okay. All right. So you'll notice one of these 3 because I think that these are, Terry, tell me, these are it, right? With that for treatment. Yep. So you're going to see one of these in your pharmacy record if that resident comes in on treatment. And then there's one little question down here that you can completely ignore. Is grayed out. It is not used for C. difficile. It is something that's embedded in here for our developers and our analytics for MDRO, but because CDI falls in the same module, it just gets put on this page, so you can completely ignore the documented evidence question. And then the last part, you're going to notice these custom fields, and these allow you to collect more data if you're interested. So you can, for example, if you're interested, if the resident has a prior history of C. difficile, if the resident was recently treated with certain antibiotics known to increase C. difficile risk, you can create your own custom fields that will populate just like this. So these that you're seeing here, those aren't questions you guys will see when entering event. I created my own custom fields just so you could see, you know, the possibilities of what you could do if you were interested. We've had facilities with antibiotic stewardship programs do things like this so they can look at stewardship and practices around C. difficile to try to identify if there's trends associated with residents coming into their facility on certain medications or with certain histories, diabetes, hip surgery. So the possibilities are endless with custom fields. And if that's something that you guys are interested in, during your hands-on analysis section, ask Elizabeth or Josephine to show you custom fields, because I'm not going to spend time on it in here. But it's definitely, it's a great feature if you're ready for it in your process of using NHSN. If you're brand new to NHSN, right now may be a little too soon to do that, just, where you are in your learning stage. But if you're more of experienced or moderately experienced, I recommend getting more information about custom fields, and we can help you set those up. And then comments are available to everyone. And this just allows you to type in whatever you want. Comments are not included in any of the data analysis that NHSN does. We do not read your comments, so put whatever you want. And this is what your page will look like when you're done, or similar. And then you're going to want to make sure that you save it. And when you save, you're going to get this little pop-up that says event X, Y, and Z was created successfully. Some people like to write the event number down. I never have, because you can easily search your events. But feel free, if you want to write down your event number, you can, but you can certainly search the events other ways. Okay, so we've talked about our monthly reporting plan. We've talked about submitting an event. So let's look at the monthly summary data requirements for C. difficile. Again, we have this worksheet that is available, and this worksheet is good if your facility is all manual. If you have no electronic anything in your facility, you're going to love this sheet, because you can drop it off at the nurse's station and ask for help. And basically what your nurses or your CNAs would do is every day they would write in how many residents are on the floor, how many admissions have we had today, how many admissions came in on C. diff treatment, and how many residents did we start on C. difficile treatment. And if every day this is completed, at the end of the month, you tally those columns, and now those are your totals to enter into NHSN. Now, if you have an EHR, a lot of this you can already capture electronically, but if you don't, then this form is just for you. Again, you can customize this form, but as you notice, this form has other questions on it because we use this form for UTIs as well. So I've highlighted in green the specific questions for CDI. So remember that every month that you have a monthly reporting plan with C. difficile, in that reporting plan, you must complete monthly summary data, okay? Even if you did not have any C. diff to report. And so this is what it looks like. Again, everything highlighted is what you're responsible for. If it has a red asterisk, you must enter some data. You'll notice here, these are all of the options in the LabID Event Module. And if they're not in your reporting plan, what do you notice? It's grayed out. Because this, remember, matches, your summary data page matches your reporting plan selection. So here, C. difficile, there's a check mark in the box indicating that that is in plan. Okay, and then you notice report no events, and it has red, which means that we did not report any C. difficile events for this month, so we have to address this, and I'm going to show you how to do that. Okay, so let's just start kind of from the beginning. So resident admissions, so that's the total number of residents admitted to your facility during that specific month. That does include new and readmissions. Resident days is each day of the month. You want to calculate how many residents are in your facility, and at the end of the month, add those totals together, and the total is what goes into resident days. Again, if you have electronic medical records, you can retrieve the number from there. You may also calculate based on facility occupancy. And some of our facilities that are completely manual very much appreciate this option because it saves you some time. So for example, If your facility has 100 beds and you're at 100% capacity for the month, what are your resident days? If you have 30 days in the month, you're 3,000 resident days, right? So 100%, so 100 residents times 30 days, 3,000 resident days. So that's your total resident days. If you have 100 beds and you're at 90% occupancy, 90 residents times 30 days in the month, you had 2,700 total resident days. Does that make sense? So it's really a guesstimate. It's not 100% accurate, but if you're really strapped for time, you may appreciate that. Number of admissions on C. diff treatment. So this informs the burden of CDI coming into your facilities, a CDI treatment prevalence. It's the number of residents who are receiving antibiotic treatment for C. difficile at the time of admission to your facility. Again, this includes new admissions and readmissions. This count is independent of CDI LabID event reporting. So it means it doesn't have anything to do with submitting a CDI event. If a resident comes into your facility and is on treatment, he or she gets included in this number, period. You don't have to submit an event. It's completely independent of that. And this is just an example of information that you can get from the analysis section. So you can look at your CDI treatment prevalence to look at, the percentage of residents coming in on that treatment. And that, again, helps you to assess the burden. Number of residents started on antibiotic treatment for C. diff. So this informs an understanding of your management practice. How do you manage C. difficile in your facility? Does your facility, for example, test your symptomatic residents and then treat based on the test results, or does your facility just go ahead and treat based on symptoms and not test? So this is what we're kind of trying to understand here, because some facilities we're hearing no longer test, they just treat. So we're just trying to get an understanding of that. It can also inform the burden in your facility. So what you're looking for here is the number of residents started on treatment for CDI that month based on clinical decisions. And this does not, it's not based on if the resident had a positive LabID event. It's not based on that. It's just based on pharmacy data. How many antibiotics or orders were written for treatment of C. difficile? So it's independent of testing. And then here, I talked about this. This just shows you that C. difficile is in your monthly reporting plan. And because the report no events is red and it's an active box, it just means that we did not have any events to report. So what we would need to do is just put a check mark in that box. I thought I had a cute little green check mark that was going to come up, but it didn't. So you'd put a check mark in the box just like that, and then you're done and you click save. And then you'll get a message that says your summary data was created successfully. So that sums up how to enter a CDI event and complete everything during the month for that CDI event. So now I just want to move over to the MDRO, or multi-drug resistant organism module. And this is very similar. Some questions to ponder. If you're thinking about potentially adding MDROs to your surveillance plan, so you want to kind of think about, do you know what MDROs are most prevalent in your facility? Is MRSA prevalent, or VRE, or CRE? If you're not sure, then maybe surveillance is a good option for you. How do you define? How do you track? Do you know what's in the community, what's coming into your facility? Your skilled versus long stay, recent hospitalization. So devices, wounds, everything that we know put these residents at risk are important to think about when you're trying to determine if you want to implement this surveillance plan into your plan. Here is a list of the MDRO options available to you. So you have Staphylococcus aureus, methicillin resistant, or MRSA. You have Staphylococcus aureus, methicillin susceptible, plus MRSA. So what this means is if you're a facility and you are monitoring your MRSA, but you're curious at looking at your resistance patterns to see what percentage are susceptible versus what percentage are resistant, then you can choose to monitor both. But you cannot monitor MSSA by itself. You have to do it with MRSA, okay? But you can do MRSA by itself. We have vancomycin-resistant enterococcus species, or VRE, cephalosporin-resistant Klebsiella species, carbapenem-resistant Enterobacteriaceae, or CRE. When you monitor CRE, here are the 3 organisms that you're looking for. So your Klebsiella, E. coli, and Enterobacter. And then we have multi-drug-resistant Acinetobacter. This should not be tabbed in. It should be out. There's a little typo there. So that's the list. This list is also available in your protocol. Okay, describe how MDRO LabID event surveillance is performed in a participating NHSN long-term care facility. So A, the facility uses NHSN's LabID event metrics to identify and report residents with selected MDROs in all resident care locations. B, the facility uses the CDC's NHSN HAI methods to identify and report residents with selected MDROs in all resident care locations. C, the facility uses the CDC's NHSN LabID event metrics to identify and report residents with select MDROs in skilled locations only. You guys are good, 100% correct. So again, you're looking at facility-wide for participation. So that's with C. difficile as well as with MDROs. Let's look at some definitions. And again, these are outlined in your protocol, which is probably much easier to read compared to the slides. But when you're choosing MRSA, you're looking for your Staph aureus that are resistant to oxacillin, methicillin, or cefoxitin. When you're looking at your MSSA, you're looking at Staph aureus testing intermediate or susceptible to those same drugs. When you're looking at VRE, or you're looking for any enterococcus species that is resistant to vancomycin. And then our cephalosporin Klebsiella, you're looking for Klebsiella species testing resistant or intermediate to cephalosporin antibiotics. And I've just listed some examples here. For CRE, you're looking for E. coli, Klebsiella species, or Enterobacter species testing resistant to imipenem, meropenem, doropenem, or ertapenem. So again, when you select CRE surveillance, you're agreeing to perform surveillance for all 3, for E. coli, Kleb, and Enterobacter. So if you see any of those meeting the definition, then you would report that for CRE. And then you have your multi-drug-resistant Acinetobacter, which is any Acinetobacter species testing resistant or intermediate to at least 1 agent in 3 antimicrobial classes. So here are the classes. So you have to have at least 3 of these with any one of these drugs resistant to meet this definition. And just a reminder, so I already mentioned several times that surveillance must occur for all resident care locations, but for MDROs, it must occur for all specimen sources as well. So if you want to look at MRSA in your facility, you have to look at MRSA for all specimen sources, not just one specimen source. Here are some common terms and definitions specific to the MDRO event reporting. We have our MDRO positive isolate is any specimen obtained for clinical decision-making testing positive for an MDRO. This does exclude tests related to active surveillance testing. So if you have an active surveillance program, you do not report those positives, okay? This is only for clinical decision-making. An MDRO LabID event is a MDRO positive isolate tested on any specimen source when the resident has no prior history for that same organism from any specimen source in the same calendar month. So this is a little bit different compared to CDI. There is an exception with MDROs, and that's when you have positive blood specimens. So if it is a non-blood MDRO, then you're only reporting 1 positive for that resident for that month. But if it's a blood specimen, you use the same rule, the 14-day rule, as used with CDI. And I've got an algorithm that's going to make that easier for you. Here are the rules. You will submit an MDRO LabID event when the specimen was collected while the resident was receiving care in your facility or during that brief outpatient visit, and is the first positive MDRO collected from any specimen source for the resident in a calendar month. What that means is the first positive for that resident will get reported for the month, okay? Or if it was collected from a positive blood culture, you report it if it's the first positive. So if the blood is not the first positive, but it is the first blood, you do report that. So let's say Mr. Smith has a positive urine collected on March 3rd. That was his first positive MRSA. You report that. A week later, he has a positive MRSA in the blood. Do you report that? Yes. And then the 14-day rule starts with the blood only. So then you would not report another blood within 14 days, but you would not report any other positive specimen other than a blood for that whole month. And I know this sounds confusing, and it is confusing, but here's the pretty picture. This, even though I've been doing this for 8 years, I still have to use the algorithm. So I recommend that you just have this available to you for the remainder of this year. And then for 2020, I think some changes are coming that's going to make it a little bit easier for you guys. But for the remainder of this year, this is your friend. Which specimens should not be reported? You don't report negative MDRO specimens. You don't report anything related to active surveillance testing. And of course, you don't report if it was collected during a previous admission. You do not report an MDRO collected from a non-blood source that has already been reported during that same calendar month. This is just another example. If the blood is the first positive specimen for the month, that's all you enter for that month. But if it's flipped, if it's a non-blood source, then you would still enter the blood. Does that make sense? Clear as mud? Okay. This is kind of long, but we're gonna see if we can get through this example. On March 27th, Mr. C had a positive VRE blood culture that was entered into the NHSN as a VRE LabID event. Okay, so March 27th. On April 2nd, he had another positive VRE blood culture that was entered at NHSN because it was the first positive VRE for the new calendar month, right? Everybody following? He had a wound that also tested positive for VRE on April 20th. The specimen is not entered since it represents a duplicate for April, right? Following? That makes sense? On April 22nd, he had another positive VRE blood culture. Since the isolate represents that unique blood source, it's been more than 14 days since the last positive VRE blood, it is submitted to NHSN. Okay, let's test you now. Okay, so this is not a poll everywhere slide. This is just a shout it out. So this is Mr. Jones, and we're going to assume that these are all of the positive labs that we have for Mr. Jones. So he has the same current admission date of February the 1st. And so let's just look at the specimen collection dates. So he had a specimen collection date of 2/2 with urine, and it was positive for MRSA. Are we going to report this? Yes. So this is his first positive for that month of that organism. Then on 2/17, he had a wound that was positive for MRSA. Would we report this? Very good. No, because it's not blood, and so we don't care about it since we already reported something for that month. Then on 2/21, he had a positive blood for MRSA. Would we report that? Yes, we care about those bloods. And then 2/26, he had another positive blood for MRSA. Very good. It's duplicate. 2/28, he had a nasal specimen that was positive for MRSA. because most likely that was screening. And then 3-1, he had a blood that was positive for MRSA. Yep. That was the new calendar month. So, yep, because it represents that new calendar month. And that's where it kind of gets tricky. And that's where I have to pull out my algorithm because I forget that sometimes. It does not. It starts over based on the calendar month. But other than that, it doesn't. Yep. Now, had that blood not been the first positive of the month, it would not have been reported because it would have been within that 14 days. And then on 3/11, he had a positive urine. Nope. And then on 3/14, he had a positive urine with VRE. Yes, because that's a new organism, a new bug. Okay, good job. I can sit down. I mean, you guys already know all this stuff. Just like CDI, NHSN categorizes your MDRO LabID events, and they're based on your current admission, specimen collection, and the past, your recent transfer from acute care facility. So these categorizations are exactly the same definition. So your community onset is if that specimen was collected within the first 3 days of the current admission. Long-term care facility if the specimen was collected after 3 calendar days after the current admission. Any long-term care facility onset that will be further categorized if that resident recently transferred within the previous 4 weeks from acute care, and that would be an ACT low. So again, here's your visual. And they're not, NHSN does not do the incident and recurrent for your MDRO. So that's kind of the difference. So the 3 categorizations that we just talked about, those are your categorizations for MDRO. And submitting your monthly reporting plan, exactly the same as we just did for CDI, except for I'm just going to show you what you would select. So you go to your reporting page, you're going to click Add, and you go right to this LabID Event Module section. And what I want to show you here is by default, you have 2 rows. So you're able to, so let's say you do CDI, so that takes 1 row, you have 1 row left. Well, if you want to select more than 2 here, all you have to do is just add a row. You can keep adding the rows until you add everything that you want to add. If you're adding multiple rows, because we know that can take some time, my recommendation, and this is really the only time I would ever copy from a previous month, is if I had numerous rows here, because it takes time to add. But if you have, let's say, more than 2 rows, or maybe if you have 2 or more rows, it will be to your benefit to start copying from previous month and building out your year-long plan or your 6-month plan, because it's going to save you some time. But otherwise, you just keep adding rows and you select your organism from the drop-down box. And then the box over here, checkbox, will auto-populate for you. And don't forget to save. When you submit an MDRO event, just like we talked about with CDI, you can use our optional forms, and we have table of instructions for those forms. And I don't know that I mentioned this previously, but 1 form per event. So the form, unlike the denominator forms where you can use that for all of your summary data, the event forms are 1 form per event. So if you have a resident with C. difficile and with MRSA, that resident would have 2 separate forms completed, but it is the same form for CDI and MDRO. Okay, and we talked about this. To add your event, you're going to go to your navigation page, click Add. Oh, and I just want to show you this while we're here, because I can't remember if I have a slide on this, but there is a really cool feature here. You can actually click Find, and I may have a screenshot, but and maybe the ladies can show you this in the data analysis class, but if you want like a neat line listing of all the events that have been entered for your facility, you can click find and then find again, and it just gives you a nice line listing of all the events that have been entered, and it's updated as so even an event you just entered 5 minutes ago will populate on that. So if you're going to data analysis class, ask them to show you that. The resident information is exactly the same, resident ID, gender, date of birth. So let's say we just previously entered a C. difficile LabID event for this resident. When we pull up this page and we enter his resident ID or her resident ID, the resident information is going to populate for us. So we won't have to enter anything there. And then I'm going to kind of fly by. If you need me to slow down on this, just raise your hand. But we just talked about this. So the resident type, you're going to select short stay or long stay. And we have the definition there for you. And then you're going to enter the date of first admission to the facility. So remember, that date's going to stay the same unless the resident leaves for more than 30 consecutive days. And then you're going to enter the date of current admission, which will be the same as date of first admission unless the resident has left your facility for more than 2 calendar days. Event type is going to be LabID event, right? Date specimen is collected is also called the event, date of event or event date. And remember that the specimen collection cannot occur before the current admission. Specific organism types, this is different. For C. difficile was easy. We just selected C. difficile. But when you're looking at your MDROs, you have all of these options here. So you're going to want to select the correct organism type. And then you will have to complete the specimen body site system, unlike C. difficile. So you'll have a drop down and you just select from here. So if it's a urine specimen, then you're going to select GU for genitourinary system. If it's a wound, then you may select SST. I would recommend, and I don't like this on here, and actually we need to talk about removing this, Janita, but I don't like unspecified because that's easy to select unspecified, but how are you going to do any analysis of that unspecified? What does that even mean? So I would make it as specific as possible, because when you're doing your analysis, and this isn't for us, this is for you guys, when you're looking at, okay, where are we seeing this MRSA? Are we seeing it in wounds and blood? Like, where are we seeing it? Be as specific as possible. But if you do select unspecified because it really is unspecified, I would put like a little comment for yourself or for the next person who's looking in your application, so a new IP or whatever, so he or she will know what's going on with that resident. And then your specimen source. So if we have a urine specimen, we would select probably the urinary specimen, the bottom, unless you did a swab. And then again, your resident care location. So this is the location where that specimen was collected. And same thing, your service type. Has a resident been transferred from acute care in the past 4 weeks? If you select yes, you're going to have additional questions. So you're going to want to enter that date. And then the same question about antibiotic therapy. Again, this is going to inform burden of MDROs coming in your facility. Was that resident on antibiotic? Was that resident being treated for an MRSA infection or a CRE infection upon transfer to your facility? And then again, the documented evidence will be grayed out for non-editable. And again, here's the custom fields. Remember, the custom fields are going to be blank for you guys because these have to be set up by you, but I just wanted to show you an example, and then you have the option to do comments and free text for your own internal documentation. And then here's what it looks like. You click save and you'll get that nice event number. I also want to mention that you can edit your event. So let's say you entered an event and then you go home that night and you think about, oh, I forgot to enter this, or I think I entered that incorrectly. You can go back and pull up that event and click edit and change anything you want to change. And just make sure you resave it. So next we're going to look at the monthly summary data for MDROs, which is very similar to CDI. So it's in the same section here. So you're going to have your resident admissions, resident days. Again, whichever organisms are included in your monthly reporting plan, they're going to be checked. You know, there's going to be a check mark on this box. So you see C. difficile is not included in this one, right? And then report no events. You notice how MRSA is grayed out because that means that we've already reported we did report an event during this month, but we did not report a VRE event. So you guys see the difference? Again, here is the monthly summary for participation. So you can see here, if you're just following MDROs, then your requirements for summary data have slimmed down quite a bit. So you're looking at your number of admissions, you're looking at number of residents, number of admissions, and that's it for MDRO. So you don't have to complete this entire form. It's going to be based on what is in your monthly reporting plan. And again, to enter, we're going to go to summary data and then add. And then enter your month and your year. And your page is going to populate based on that monthly reporting plan. Based on the monthly summary data below, what modules and events did the facility select to participate for March 2019? So I'm going to give you guys a minute to look at this. So A, all modules, all events. B, MRSA LabID events only. C, all MDRO LabID events. D, MRSA and VRE LabID events only. Or E, VRE LabID events only. After lunch, the end of the day, and you guys still got 100%. Very good. Good job. So it was MRSA and VRE LabID events. So you can see here, we know that because when you look at LabID, those two are the only two boxes checked, right? Nothing else is checked. So that means these are the only two reflecting what's in our monthly reporting plan. Resident admissions, you're going to enter the total number of residents admitted to your facility during that specific month. Again, it includes new admissions and readmissions if that resident was out of your facility for more than 2 calendar days. Resident days for each day of the month, record the total number of residents at the end of the month, add that total into NHSN. Just like we talked about for CDI, you can also calculate based on facility occupancy or if you have electronic medical records. The LabID event all specimen row. So this will be, again, shows you which organisms are under surveillance for the month. And again, that's based on your monthly reporting plan. Report no events. If there's a red asterisk, that means that this yes is indicated in your plan, but you did not report any VRE LabID events for this month. So what you would have to do is just put a check mark to acknowledge, yes, I performed surveillance, but we did not have any VRE. Here, it's grayed out, and there's no red asterisk, so you don't have to do anything there. So you put your little check mark, and then you save it, and you're done. And this is what it will look like. Okay, we're almost done. You guys are troopers. You're doing so well. So we have a few more slides just to talk about data quality. Really important that you resolve any outstanding alerts. So these alerts are one part of a balance check act that we implement into NHSN to remind users to, hey, let's make sure your data is good, because you want your data to be accurate, especially if you're benchmarking against yourself. You want to feel sure that what my numbers look like in 2019 are comparable to what I'm going to see 2020, because otherwise you're not going to know if your increase or decrease is meaningful, and you want it to be meaningful. So make sure that you're putting in good, clean data, that you're doing these automatic checks that we suggest to make sure that the quality is there. As far as analysis, when you learn about analysis in your sections, they're going to tell you when you go to your analysis section, the only data that's going to show are complete months. So if you are missing data in any one month, that month is going to be missing from your analysis. So it's very important to resolve these alerts before proceeding to analysis. So you don't want your page to look like this. Common alerts for LabID events are your missing events. So LabID Event Module, what this means is that you selected, let's say, CDI or MRSA in your monthly reporting plan, but you did not report either of those. So some people think, oh, I didn't report any, I'm done. But it's not true. Remember, you still have to address that in your monthly summary, right? So to resolve this alert, trying to see what screenshot. So you would go to your missing events. You click that. It tells me here I have 2 missing events. So we want to look at the LabID and see we just didn't report events. So what I would do in this case is I would go back to this month and year, and hopefully you don't have to go back this far, and I would just verify we did not have any MRSA for that month. And then I would simply put a check mark in the report no events, and I'm done for that. Same thing for the UTI. If I did not have any UTIs for that month, I just put a check mark there and save, and those 2 alerts are resolved. Missing summary data. So this could happen if you just did not complete your summary data for the month. If you forget, or if you think, well, I didn't have any events, so I don't have to complete summary data. But remember, if you have a monthly reporting plan on file, you have to complete summary data even if you had 0 events. So to resolve this, you would click the missing summary data. That's going to give you a line list of each individual error, and so you would just click on add the summary, and you can see at the bottom. So when I clicked add summary, I got this down here, and everything with the red asterisk and it's highlighted yellow means I need to address that. And so in this case, I need to put in my resident admission, resident days, and number of admissions on C. diff treatment. Do I need to do anything with MRSA? No, because it's grayed out. There's no red asterisk. So that means that I did report at least 1 MRSA event for the month. C. difficile? No, because there's no red asterisk. So the only thing I need to address are these 3 things here. Incomplete summary data. Again, this comes down to not checking report no events, and it's easily resolvable. Oh, you guys are going to get a little break. So here's some resources. These links will take you straight to the MDRO and CDI LabID event page, where you can find training and protocols, forms, key terms, frequently asked questions. And don't forget, if you have questions, if you have comments about improvements you would like to see, or if you find an error in the protocols or something that you need to bring to our attention, please send us an email. Here's our email address, nhsn@cdc.gov. I do recommend that you put in the subject LTCF so that it gets immediately triaged to our team, because we are a different team. Here's what our homepage looks like. And now we can take questions. What questions? So come to the mic so our web streamers can hear you.
To the revised McGear's criteria. So I was wondering, when you're doing community versus long-term care acquired, so you have the 3 days versus McGear's. Now, granted, we're doing signs and symptoms versus lab. I don't know if that's the rationale, but McGear's is 2, you have 3. So I was just wondering why the difference.
So McGear, those definitions are based on the HAI.
Right.
methodology
Right.
versus the LabID events is a completely different methodology.
Okay, so it's
So that's where you see the discrepancy between the two methodologies. Now, when we get to UTI tomorrow, that is the same. It's based on the two HAI, 2-day HAI, and the 3-day came from it was there's a paper, and I may have the paper cited on the slides, but I would recommend that you read that because I can't remember exactly why they chose that. But I do remember that the paper, they did research and they looked at different organisms and different facilities, and the expert panel came up with the 3 days. And the paper, I think, discusses why that came about. So if it's not in my slides, catch up with me this week and I'll find that reference for you.
okay. And then the second question is about Acetobacter. So why is MDR to 3 classes versus the traditional definition of 1 class or more, 1 or more classes?
That's a good question, and I don't see our ID docs in here to ask. So I'm going to let Dr. Rowe tackle that one.
Oh, sure. So I was just wondering for Acetobacter, why is the MDR 3 classes versus the traditional definition of 1 or more classes for an MDRO? Okay.
And it could be there. And what I wonder is when they developed. So that was something they developed a long time ago, and so when the expert panel comes together and looks at definitions for NHSN, they're trying to come up with the most objective definitions, and so it makes me wonder, is there some subjectivity in the 1 versus 3?
And I wasn't sure if it was because of is the 3 classes on your target list? Because the CDC target list for certain MDROs, the 1, 2, 3. So I wasn't sure if that was the reason behind it. So I was just curious. Okay. Okay, great. Thank you.
Any other questions? Oh, another question?
Trying to distinguish between the summary data and the events. Okay. So I've always just submitted the summary data.
Okay.
So for example, last month, I had a patient that was a recurrence of CDI. Mm-hmm. So I didn't fill out an event because it didn't match the definition. So I've got the number 1 sitting there, but at the same time, I'm putting reported no events, and it feels like it's somewhat it doesn't look right that way.
Right. And that's okay because we're looking at different so you mean it didn't, okay, so you're saying it was so why didn't the event meet to report it?
Because it was within 14 days of the last positive result.
Okay, so it was within 14 days, so it was a duplicate.
Normally we wouldn't test, but she needed pre-op testing, and that's why it came up.
But then was the resident and which question was added to the summary data?
The part where they actually started on an antibiotic treatment. So I had to put yes for that because we did have somebody start on it, even though it wasn't necessarily a valid.
See, and that's important for you to know. So think about that. I mean, when you're looking at your practices, maybe at the end of the year, and you can look at, okay, so we had this many CDI LabID events for our facility for this year, but we had this many residents started on treatment. And so it allows you to look at those discrepancies, and you're going to have some discrepancies because surveillance data is not perfect. But if you see a huge, disparity between the two, it's a red flag for you to be able to go back and say, okay, let's take a look. Why do we have this? Why is there such a discrepancy between our LabID events versus what's treated?
So is that just for my use? If I'm tracking that really closely anyway on my own, in my own line listings and my own follow-up each month, is it necessary to fill out a LabID event for NHSN? Does that help your purposes as
It
well?
does help our purposes. Yes.
So fill out those for any LabID event that occurs that
Definitely.
matches the definition.
Definitely, because one thing that we're doing is we're trying to develop national benchmarks for
Okay.
you all to be able to compare your data to. And without having the data, we can't do those benchmarks. So we really do need the data, and we're looking at the data at an aggregate level. So we're not saying, Mr. John, I don't know what your name is, but
Aaron.
we're not saying your facility did this and did that. We're looking at just the numbers. Okay. So we have 2,000 facilities in the month of March who had positive CDI events, but we have 10,000 facilities who started treatment in March. So that's the kind of stuff that we're looking at, and it allows us to do further research. And our prevention team gets that data, and they're like, okay, what do we need to do for our providers? What kind of education do we need? What kind of policies need to be put in place? What's going on? And so it allows us to see what's going on in your world, so that we can help you guys.
And then if they're admitted on VANC, say for C. diff, we don't count that under the second value as started on antibiotic treatment.
Correct.
Just the admission number.
Correct. And nor would you do a LabID event for that resident unless you did another collection.
Okay. That clears it
Great
up.
questions.
Thanks.
Thank you for asking those questions. Did everybody get that? And definitely, if you're ever in doubt, shoot us an email. We try to get to your emails the same day if we can. So we'll get you a response really quickly to help you. And never feel like that's a burden to us, because we appreciate you reaching out to us, because that helps us to understand where your struggles are. And when we understand where your struggles are, we're able to better educate and put other efforts and resources in place to help you. So I'm very glad you asked that, because we see what you're asking. We see those discrepancies in our data, in the aggregate data we're receiving right now.